The global pharmaceutical industry generates billions of dollars a year. A massive portion of that revenue doesn't come from discovering new drugs, but from deliberately delaying generic competition for the drugs they already sell. No company mastered this strategy better than the pharmaceutical giant AbbVie. For years, their flagship immunology drug, Humira, was the highest-grossing medicine in human history. AbbVie maintained that revenue stream by building what industry experts call a patent thicket. Instead of relying on a single patent, they filed hundreds of minor, overlapping patents on everything from manufacturing processes to specific dosages. This created a dense legal web that artificially extended their exclusive market control for years. The capital generated from that extended monopoly funded the development of AbbVie's next major immunology blockbuster, Upadacitinib, marketed globally as Rinvoq. To protect this new asset, AbbVie's global business plan relied on simply copying and pasting that exact same impenetrable legal shield in markets all over the world. While Western nations often grant these secondary patents with little resistance, India maintains a highly strict legal barrier designed specifically to block monopoly extensions. That barrier is Section 3D of the Indian Patents Act. It acts as a statutory gatekeeper to prevent pharmaceutical evergreening, the practice of making minor modifications to known drugs to secure fresh patents. So when AbbVie filed patent application 4759/DELNP/2012 to secure market exclusivity for Upadacitinib in India, they hit a wall. A coalition of domestic generic manufacturers and public health advocates immediately launched a pre-grant opposition. This legal mechanism allows challengers to present evidence against a patent before the government approves it. This opposition forced a direct collision between a multinational corporation's proven financial playbook and a nation's strict public health defense system. During the hearings, AbbVie argued that Upadacitinib deserved a patent because it featured a specific chemical optimization. They claimed this structural tweak provided improved stability and a higher selectivity for targeting the JAK1 enzyme over older drugs in the same family. But there was a massive legal precedent hanging over AbbVie's defense, the 2013 Supreme Court ruling against the Swiss drug maker Novartis. Novartis had attempted to patent a slightly modified beta-crystalline form of their cancer drug Glivec. They argued the new form had a 30% increase in bioavailability, but the court outright rejected their application. This data visualization shows exactly how the court defined the standard of therapeutic efficacy. The chart on the left demonstrates improved chemical stability, which the court rejected. The chart on the right shows an actual increase in patient survival, which is the only metric the court accepts. Chemical stability or bioavailability means nothing under Section 3D, unless the drug actually cures the patient better. Because of the Novartis ruling, AbbVie's claims about Upadacitinib's chemical optimization were legally useless unless they could prove their specific molecule possessed a superior curative effect on the body. The Indian Patent Office discovered a fatal flaw in the application. AbbVie completely failed to provide head-to-head comparative data proving that Upadacitinib had better curative properties than the known chemical compounds it was based on. Without empirical medical data to support a therapeutic leap, the Patent Office legally classified AbbVie's chemical tweaks as obvious routine optimizations. That immediately triggered a hard rejection under Section 3D. The application also suffered a secondary critical failure. Opponents proved that AbbVie's early priority documents lacked the specific chemical structure for Upadacitinib, effectively invalidating their timeline and exposing the patent to prior art. This tactic was part of a broader pattern. Around the same time, the Patent Office also rejected AbbVie's blockbuster cancer drug Venetoclax for similar attempts to transform unpatentable treatment methods into broad product claims. By strictly enforcing the rules, the Indian Patent Office dismantled a multi-billion-dollar corporate legal strategy simply by demanding empirical proof of a medical breakthrough. In April 2026, the Indian Patent Office definitively refused patent application 4759/DELNP/2012, killing AbbVie's attempt to monopolize Upadacitinib in the region. With the primary legal barrier now completely gone, domestic pharmaceutical giants like MSN Laboratories and Natco Pharma were immediately greenlit to produce the drug. These domestic facilities are rapidly ramping up their assembly lines to create affordable, high-volume generic versions of the therapy, years ahead of schedule. This legal defeat transforms a highly expensive corporate asset into a widely accessible public health resource for patients suffering from severe autoimmune diseases like rheumatoid arthritis. This production capacity directly impacts global health, cementing India's long-standing position as the pharmacy of the developing world. The rejection sends a clear message to multinational pharmaceutical companies. Artificial evergreening tactics and minor structural tweaks will not survive strict evidentiary scrutiny. India's patent system demands true, measurable scientific breakthroughs that directly benefit patients to justify the grant of a monopoly. The Upadacitinib decision can stop a nation's intellectual property laws can be wielded to ensure the accessibility of life-saving treatments, prioritizing public health over perpetual corporate exclusivity.